presentation will be the Ontario Medical Association.
Good afternoon, members. My name is Dr. Andrew Park, and I'm the president of the Ontario Medical Association. I've met with a lot of you, and it's nice to see a lot of you again. On behalf of Ontario's 43,000 doctors, thank you for the opportunity to appear here today. In January, we brought forward 11 recommendations to this government to see progress in 3 key areas. And last month, we were encouraged to see some of these solutions reflected in the latest provincial budget. However, while Ontario's doctors say that the healthcare measures in the budget are a welcome start, much more work at a faster pace is needed. Before I elaborate on this point, I would like to begin with a reminder that our system affects the health and well-being of every Ontarian on a daily basis. I witness a system that is at its breaking point every day as an emergency physician. And this speaks to the struggles that doctors across the province are experiencing due to the major cracks in our system that have ballooned over decades. Last October, we released our latest advocacy document, which contains pragmatic solutions to address our 3 urgent healthcare priorities. Today, I want to remind you that these 3 key areas are where we need to focus our immediate action and build on recent investments. Firstly, it is imperative that we fix the crisis in family medicine. Every Ontarian should have a family doctor, full stop. This budget builds on the government's initial investment in team-based care in line with the OMA's recommendations, and we are glad to see that the province is moving forward to implement it. However, we must move much faster. We forecast that there will be over 4 million Ontarians without a family doctor by 2026. That is 1 in 4 Ontarians. System-level solutions are also needed to address this crisis. We need to reduce the burden of unnecessary administration to enable doctors to spend time caring for patients. The OMA is committed to our ongoing work with the government to tackle this. The OMA is also called to tackle hospital overcrowding, which is heightened by limited community capacity. We're pleased to see the investments in home care and palliative care in this year's budget as a means of strengthening community capacity. At this time, I would like to turn your attention to our CEO, Kimberly Moran, who will discuss our thoughts on the latest provincial budget in further details.
She's coming here. Yeah.
Thank you, Dr. Park. Fixing Ontario's healthcare systems needs to be addressed urgently. Every Ontarian deserves a family doctor. Our taxes pay for that. The OMA wants to work together to build a system Ontario deserves. We've been sounding the alarm on the family medicine crisis for years now. That seems to be falling on deaf ears. Maybe we have to say, prepare for the coming apocalypse to get the right attention to this issue. We appreciate the investments the government has made, but the work is happening too slowly to stop the rapid increase of unattached patients, estimated at 1 in 4 by 2026. We all know the solutions, they're well agreed. For this specific budget, just under $200 million per year was advanced towards primary care teams, which we appreciate. It's unclear exactly how much is going towards the expansion of teams, when that funding will roll out, but Ontarians can't wait till the 3rd year. Even that funding is not enough. Using the government's numbers, investment required to expand teams to all Ontarians is over $1 billion, 6 times that amount. We strongly urge the government to act much faster, to invest much more to expand interdisciplinary primary care teams to all Ontarians. The lack of investment in building a primary care system over the last number of years is also resulting in a staggering admin burden borne by doctors. The OMA has called on the government to reduce this unnecessary administration, an alarming 19 hours of physician time each week, keeping them from patient visits and clinical tasks. The budget didn't include any specific investments to reduce burden, but there's still an opportunity for the government to send a strong signal to Ontario's doctors. For example, a centralized referral system can be a game changer for patients and physicians. Unlike other provinces, Ontario has not invested to deal with the unnecessary complexity, frustration, and efficiency that goes into a simple referral from a family doctor to a specialist. Nova Scotia has been a leader and committed to action. BC has had a centralized referral system for over a decade, as has Alberta. Sick notes also take an inordinate amount, an impractical amount of physicians' time. We'd like to see employers prohibited from asking for sick notes. Sick notes is just one form of the many forms physicians fill out every single day. Work is underway between the Ministry of Health and the OMA to reduce or simplify government forms, but the pace has to be much faster. We also ask that the government take urgent action to reduce the burden of the MedsCheck program on family physicians. Many MedsCheck forms arrive every day into the inbox of physicians, using up unnecessary time and energy. We strongly urge the government to act swiftly to reduce doctors' administrative burden. The budget announced new medical school at York, which we're very happy to see, focusing on family medicine for underserved communities. The OMA supports the expansion of medical education as part of a long-term strategy Ontario's healthcare system needs. It's critical, though, to make successful, all medical schools need to be funded for all elements of the process from student to doctor. For example, payments to preceptors or teachers of residence and payments to students for expenses have not increased in 17 years. We will not be able to sustain the expansion in family medicine training without immediate resourcing of all family medicine teaching units. And a reminder that all the other solutions have to be implemented for family medicine graduates to remain in comprehensive care. We need much greater investment in Northern Ontario and a clear plan to address the profound challenges they're facing. Emergency department closures in the north are multiplying at a disconcerting pace, leaving patients without care and doctors overworked. The crisis will not go away on its own, and we must improve the recruitment and retention of physicians in the north. We appreciate the significant funding we saw into increasing community capacity, including $2 billion funding into home care, investment into 96 new palliative and hospice beds. Community capacity and increases thereof are key priorities. We want to remind you that physicians are fighting to preserve a system that is hanging by a thread. There is an opportunity in the coming months to affirm the physician's value to Ontarians through the process currently underway for the new physician services agreement. We urge you to ensure physician income keeps pace with inflation and make targeted investments to solve critical health systems issues. Ontarians are seeing chronic underfunding result in long wait times for health care. The people of this province should demand and receive the health care system they pay for through their taxes. Every Ontarian deserves a family doctor, but that's not the case for millions of Ontarians. 60,000 Ontarians a month lose their family doctor now. That has to be stopped. Ontario's doctors want to care for patients, but working in a system that is underfunded simply doesn't function to benefit patients or support those who provide care. The time is now to fix these issues and ensure there's a system in place for today and for generations to come. Thank you for your attention, and I look forward to answering your questions.
Thank you very much. We'll